In the face of a public health emergency, health professionals need access to timely and accurate information. Often in these moments, information can quickly change, leading to information overload that hinders decision-making. Knowledge management, or KM, makes it easier for people to find, share, and use information. In emergency settings, KM tools and techniques can strengthen how we work together and share information to ensure the latest evidence is put into practice quickly. The KM Roadmap for Public Health Emergencies, presented by Knowledge Success and supported by USAID, is a guide that walks through a systematic process for using KM during a global health emergency. It was developed for public health professionals, governments, and donors, as well as a KM lead or a KM implementing organization, and can be used before, during, and after an emergency to manage responses effectively and equitably. The roadmap contains 6 steps that help public health professionals improve coordination, avoid duplication of efforts, and share accurate information. Let's overview the steps. Step 1. Create an environment that can support the KM activities. To create this enabling environment, first, ensure that the KM activities have funding and are prioritized at the beginning of the response. Next, the stakeholders develop a scope of work for the KM interventions, and the donor identifies an organization that can lead them. The KM lead should understand and be connected to the relevant public health professionals and will ensure that KM is strategic and systematic throughout the emergency. Establish the KM lead and their roles and responsibilities, and ensure relevant partners know how to connect with the KM lead for collaboration. Set clear expectations about how others will contribute to KM initiatives. Step 2. Assess the KM needs among stakeholders, both rapidly at the beginning and then routinely throughout the emergency response. Start by defining the specific stakeholders that you need to consult for your needs assessment. Next, determine the questions you want the needs assessment to answer. For example, what types of information do your stakeholders need? How do they prefer to receive or access information? What is their preferred language? Then, select appropriate methods that get rapid information from your stakeholders and minimize time commitment. These may include desk reviews, surveys, interviews, or documenting insights from routine meetings. Finally, analyze and use the information you have gathered to adjust your objectives. The stakeholders' needs should be assessed frequently given the rapidly changing environment in an emergency. Step 3. Envision and design your KM strategy. Using the results of your needs assessment, create KM objectives that respond to the audience's needs and incorporate KM approaches and formats that are accessible and appropriate for the stakeholder audience. Determine the stakeholder audience for each of your activities, knowing different audiences require different approaches. Then select the tools and techniques that meet your KM objectives, are appropriate for the context, and can be implemented quickly in an emergency. For example, webinars can be a great tool to keep public health professionals updated throughout an emergency with the most current information and are appropriate during times of physical distancing. Next, develop an implementation plan and budget, closely considering elements to address equity and access, such as translation and interpretation services. Then develop a plan to routinely and rapidly monitor and evaluate the impact of your KM activities to meet the KM needs of your stakeholders. Finally, bring together relevant stakeholders to launch the KM strategy. This will help ensure everyone understands their own role, the role of others, and how the activities contribute collectively to the larger vision. Step 4. The KM lead develops the core set of KM activities. To do this, identify the skills required to implement the various KM tools and techniques and then build your KM team accordingly. Next, create a concept note for each KM activity that outlines the objectives, purpose, deliverables, and expected outcomes. Then, gather rapid feedback from donors and key stakeholders on your proposed KM activities and make revisions as needed. Changes are easier and less expensive during the earliest development stages. Step 5. Mobilize and implement the KM initiatives and then monitor them for effectiveness. To keep a close eye on what is and isn't working well, set up routine meetings and monitoring methods to assess your KM activities. Then, over time, review progress towards your KM objectives. In an emergency, Monitoring activities should be simple and streamlined to ensure rapid collection of information that will enable quick decision-making. Based on this information, you can adapt your KM activities as needed to enhance the impact of your work. The final step is to evaluate your KM initiatives and make modifications based on your findings. Revisit the monitoring and evaluation plan and indicators you developed within your KM strategy. Remember, you will be monitoring throughout implementation to assess progress towards objectives. Evaluation can determine if changes can be attributed to your KM initiative. Next, use your evaluation design to measure those indicators. Strong evaluations include a measurement before and after a KM activity to identify the changes and impact of it. Once you have completed your evaluation, share the findings broadly with key stakeholders so your learnings are documented and can be leveraged by others in future emergencies. This may be in the form of a written document, such as a case study or brief, or through a learning event with appropriate stakeholders. Public health emergencies will continue to challenge health professionals across the globe. During these events, it is essential that public health professionals have access to accurate, up-to-date information they can use to inform their work. KM plays a critical role in setting the public health sector up for success. For more, including additional context, a case study, templates for key activities, and equity tips for each step of the KM Roadmap for Public Health Emergencies, visit kmtraining.org. The KM Roadmap for Public Health Emergencies was developed by Knowledge Success with support from USAID